family wasn't sustainable at the pace I was drinking. My marriage wasn't going to sustain.
I chose to just cut everyone out of my life, everyone that meant something to me, my family, my son, and I didn't want to exist anymore.
I was drinking a lot. I was doing a lot of really anything that came across the table I was willing to do. Always felt like there was a need for me to escape.
I was in active addiction for at least 22 years. Certainly hit my bottom and knew that I needed help. I had some really good friends of mine that came in and said, we know where you need to go.
I remember the friends that I had showing up at my doorstep and saying, you've got to do something.
I was really scared to leave inpatient. I didn't know how to live life. You know, having been an alcoholic or a drunk for 20 years, I didn't know life without it.
I didn't keep friends. I kept prisoners and victims. You know, people in my life felt like they had to be there. I remember being in South Carolina and talking to people, and it was just like plans of escaping, plans of getting better, as we were all doing the same things over and over.
So my therapist there recommended Perspectives.
Got to try something we've never tried before, which was Perspectives.
What I love about the people here is just the realness. You know, there's authenticity in the people that work here, and it's not just work for them. It really is a passion.
It's not necessarily a job for them. It's their life. It's who they are.
I never felt like I belonged really anywhere or in any situation. And I felt like I belonged here. And the people here is what made that happen.
Perspectives really is close-knit.
Just immediately, I just felt love. I felt accepted.
You also have to have people around you that know that you can do it. And I feel that way when I'm here.
It's the people that make the place.
One of the things that I love and that really shaped the experience for me is that the majority of the people working here who, you know, are having direct interactions with the clients are people who've gone this journey themselves.
I'm Dr. Eric Milbrandt. I'm an addiction medicine specialist. I work at Perspectives. I'm also a certified trauma professional.
My name is Sharon Chauncey. I live in Ocala. I have been in the field for 38 years.
Craig Hughes. I am a certified addiction professional, and I am the program director here at Perspectives.
Hey, I'm Steve Blank, and I am the operations director for Perspectives Integrated Treatment and Sober Living in Ocala, Florida, and in Summerfield, Florida.
Whatever Perspectives and the people here threw at me, I just dove in.
A lot of places you can go to and stay off of drugs and not drink. It's different because it's not just about the drugs and alcohol, it's about all the other stuff.
You can't really just treat the addiction. You can't just treat one part of the problem. You have to treat the whole person.
Without a doubt, just stopping alcohol or drug use doesn't really help a person get better.
I think that we really focus here at Perspectives on building a program that kind of sets us up for success across the board in all facets of life.
You know, this is a lifestyle change. Getting clean and sober is almost a prerequisite.
So it's not as simple as, oh, we'll just stop using or, oh, just stop drinking. It's about rebuilding your life and building this foundation that sets you up for success in the long term.
I found a lot of the recovery meetings that I went to through this group of people, which really gave me a foundation in my sobriety.
You know, the other thing that I've loved so much about working here is the different modalities of treatment that we have and the different levels of care, because we really run the full spectrum. You know, with the exception of inpatient, we can meet so many needs. And I think it's hard to find a one-stop shop, so to speak, that can address so many issues. Whether it's psychiatric services, whether it's medication-assisted treatment, intensive outpatient, individual sessions. You know, we have the ability to kind of build these individualized treatment plans and meet clients' needs where they're at, and not just say, oh, well, this is what we can do and this is all we have.
So I felt confident, you know, when I was when I went home. And I wouldn't have if it weren't for Perspectives.
Yeah, without that support system, it never would have happened.
One of the most profound steps that I made was walking through the door. And it's the hardest step I ever made too.
Something can look so big from the outside, like making that first step into getting into a program, or even, going into an AA meeting, or anything that's gonna, make a long-term significant change in somebody's life. That can look so big, but taking that first step is crucial, because nothing changes if nothing changes.
Asking for help is probably the hardest part of it all.
That first step is terrifying. It's hard to be honest, and it's hard to ask for help, but things get immeasurably better.
Making the phone call or walking through the doors here at Perspectives is still the unknown. So, don't allow fear to creep in.
The hardest thing in the world to do was put my foot through the door. But once I did, there's such a relief.
There is hope, there is help. All you need to do is reach out and ask for it.
And it's really hard to understand when you're in the throes of addiction, but it really is possible. And it's possible for anybody who's willing to take a chance to do the work and to ask for and accept help.
I still struggle to quantify how much better things get.
Recovery is not promised to be easy. But you don't have to do it by yourself.
You can't do this alone. It has to be an effort of us working together. And so if you're thinking about taking a chance, getting into recovery, just take that first step. We're here to help.
Please take the opportunity to give yourself a break. Call the toll-free number.
Don't think about next year. Don't think about 2 years from now, 5 years from now. Put the work in today.
Making that first step, it's possible. If I can do it, anybody can do it.